Good morning, good afternoon, good evening, friends and colleagues from near and far. It is a great pleasure to have you join us this afternoon. My name is Sridhar Venkatapuram, and I am sitting in London, United Kingdom. And I would like to begin by introducing the group that is hosting this seminar and the Geneva Graduate Institute, and then our purposes of our group, and then moving on to introducing our main speaker. This seminar series is called the Global Health Justice Seminar Series, and it is organized by the Independent Resource Group for Global Health Justice, and it is being hosted generously with time and logistics by the Global Health Center at the Geneva Graduate Institute under their Global Health Justice series. And so it is two different organizations that are coming together in order to be able to raise our understanding about global health justice issues as a result of this pandemic and beyond. So let me begin first by telling you a little bit about the Global Independent Resource Group. We are a group of philosophers that came together last year for achieving three things. When the initial global response to COVID, as it was called, starting in last early spring, began to take shape, we believed that philosophers, particularly political philosophers who work on global justice and global health ethics, should come together in order to support the response. And that response later took the shape of something called the ACT Accelerator, where the biggest international agencies and funders came together and developed a structure called the ACT Accelerator, which included three pillars at that time. So one pillar was focused on testing, one pillar was focused on protective equipment, and one pillar was focused on vaccines. And later on, there was a fourth cross-cutting pillar on health systems and equity, etc. The idea was that we as philosophers would serve as a resource group to help assist all the many organizations and committees that were involved in that ACT-A accelerator, and as well as anyone else that wanted to have us help them. The second and third goal of our group was that, two, we wanted to raise issues around equity and justice that may not be raised within these institutions. As many of you know, if your boss is governments, then there are certain issues that you will never be able to raise as a result. And therefore, we wanted to be able to, as an independent group of philosophers, be able to raise issues that may not be raised. The third goal that we wanted to achieve was to increase public deliberation and understanding about global health justice and equity issues. And we have done that partly through seminars such as this, where we hold one every other month. We've also held a conference at Oxford in April. And if you missed that, we hope that you will look at the recordings. We've also been writing various blogs and articles, and we continue to do so. So beyond the group that we call URGE, the Independent Resource Group for Global Health Justice, the second institution involved in this seminar today is the Global Health Center at the Geneva Graduate Institute. And I want to especially thank Elisa Cotado, Ziwan Yang, and Nora Sada for doing all the logistics that is necessary in order for us to get together. I also want to say that they have a large number of events that are going on, and I sort of encourage you to look at them. And I will tell you a little bit about the next one at the end of this seminar. So to give you a quick tour of this seminar today, we are going to go for an hour and a half from now until 1.5 from now, wherever you are in the world. In Geneva, it is 4 p.m. to 5:30 p.m. And the screen in front of you will have three things. It'll have the screen of the presenters that are presenting. And today we have no slides, so you will see our beautiful faces as we speak. And then the second and third thing is that there is a chat window that you should open up, and we encourage you to have discussions with each other, to raise points that you feel are important, and to sort of provide more ideas to the discussion. The third part is that you should have a Q&A box as well. And so we are going to be taking questions later on in this session, and it is really important, and I want to really encourage you to write down your questions. We are going to try to address as many questions as we can, but the really important thing for us, particularly as a group of philosophers, is to be able to understand the kinds of questions people have, so that we can potentially spend time trying to answer them, not just today, but in the future. But it also allows us to record the diversity and the scope and nature of the kinds of questions on this issue. So please do think about one or two questions that are really important to you as a result of listening, or you are coming with, that you would like to have answered. And we will save these questions, and we will also present them on our website alongside the recording of this. And I think that hopefully is all the logistics and background details of today. So let me then move on to the main subject of today. I don't think that there is it is one of the most important and pressing issues of our times, is to figure out how we can get life-saving commodities, particularly vaccines, to the entire human population, or as much as needed in order to curtail this pandemic and prevent deaths. And one of the most central points has been that in order to get vaccines delivered to as many people as possible, there are different ways of doing it. And one of them has been seen to be the waiver of patent protections at the WTO in this public health emergency. And I can't think of any better speaker and expert than Ms. Jayashree Wattal, who has worked on different sides of this issue. I'm going to read to you a biography, so apologies for reading, but I want to make sure that I give you the accurate information. Jayashree Wattal retired from the Intellectual Property, Government Procurement and Competition Division of the World Trade Organization in mid-2019, contributing inter alia to work on TRIPS and public health, patents, undisclosed information, economics of TRIPS, IP and transfer of technology, and IP and competition policy. She assisted the then director of the Intellectual Property Division on the negotiations that led up to the adoption of the Doha Declaration on the TRIPS Agreement and the public health in November 2001, the inter-waiver solution in August 2003, and the protocol on the amendment that resulted in Article 31 bis in December 2005. She currently holds the position of honorary professor at the National Law University, Delhi since August 2019, and has been a part-time adjunct professor at Georgetown University Law Center since 2009, teaching a course on international trade, intellectual property, and public health every year. She has been a member of the governance board of the Medicines Patent Pool, a nonprofit organization based in Geneva, for 6 years. She holds several part-time consulting positions to assist on TRIPS-related issues. Ms. Wattal holds postgraduate degrees in both law and economics, and prior to joining the WTO, has had more than 22 years of experience in the government of India. She represented India at a crucial stage in the Uruguay round TRIPS negotiation from 1989 to 90, contributing substantially to the development of this text. She's the co-editor of 3 WTO books, a handbook on the TRIPS agreement, the making of the TRIPS agreement, and trade in knowledge. She has authored a book, Intellectual Property Rights in the WTO and Developing Countries, and several peer-reviewed journal articles on issues related to the law economics of intellectual property rights. So given this incredible moment in time in our world history and in the pandemic, I can't think of a better person to be able to discuss, to teach us, and to be here as we ask our questions. So with that, I hand it over to you, Ms. Wattal. You are on mute.
Sorry about that.
Fantastic.
Okay. Thank you so much, Sridhar. Good morning, good afternoon, good evening, as Sridhar said, to everyone around the world listening to us. I'd like to thank you all for tuning in, and I'd like to thank Sridhar in particular for inviting me to speak at this prestigious forum. So let me start. Let me begin with the numbers on vaccine equity, which a lot of you would be familiar with. Unfortunately, little has changed in the last few months, except that the inequity in vaccine distribution has widened even further. So COVID-19 vaccinations began in December 2020. A total of about 2.5 billion vaccine doses have been delivered to date, according to the UNICEF dashboard that I just checked this morning. Of these, the kovacs deliveries, which are mainly to poorer countries, are only 88.25 million doses so far, less than 4%. Here we're talking about deliveries, not jabs in arms. And so these COVAX deliveries include also some doses which have been delivered to richer countries such as Australia and Canada. So COVAX, which is the primary vehicle for delivering vaccines to poorer countries, particularly in Africa, has not done so well so far. Now, with some exceptions, if you look at deliveries on the UNICEF dashboard, almost all countries at the bottom of the ladder are really from sub-Saharan Africa. And the least vaccinated in terms of percentage or proportion of population is Burkina Faso, with just 0.04%. Whereas others right on top of the scale in Europe, North America, and even some in South America, that is Latin America, they're well on their way to vaccinating their entire adult population, if not by the middle of this, by the next month, certainly by the fall of 2021, this year. So at this rate, vaccinating every adult in the poorer countries may well take over the next few years, by which time hundreds of thousands may have died in these countries, will have died in these countries. And the pandemic is going to continue for everyone with the variants that are coming in as, quite frightening variants like the Delta variant and so on. The Delta variant, I believe, is going to be the predominant variant, and it's really much more dangerous than the original virus. Now, vaccines, this is like in general, vaccines to prevent and therapeutics to treat infectious disease pandemics should be regarded by all as a global public good. That's a no-brainer, really. And ideally, they should be distributed free of cost or at affordable prices to everyone around the world, irrespective of income levels, as soon as possible, as soon as it is possible or practicable. And the logic of this is because in a globally interconnected world, as is oft repeated, no one is safe until everyone is safe. So that's why it makes sense from a global health perspective to vaccinate everyone around the world. But it also makes sense to do so from an economic perspective, since global economic losses far outweigh the cost of any such distribution of vaccines and therapeutics. The IMF, in its last World Economic Outlook, has estimated that world output decreased by an unprecedented 3.3% of GDP, and world trade decreased by 8.5%. Based on an initial paper, and this was just 1 year, 2020. Now, based on an initial paper by Ruchir Agarwal and Tristan Reed, the IMF has backed the estimates that they made that vaccinating 40% of the world population by the end of this year and 60% in the first half of 2022, up to 60% by the first half of 2022, would bring global benefits of about $9 trillion to the world economy, far outweighing the costs of vaccination, which are estimated to be about $50 billion. That's really a drop in the ocean compared to the benefits. So this proposal from the IMF, which has the backing of the heads of the World Bank, the World Trade Organization, the World Health Organization, proposes that about 35 billion should be paid by grants from donors and the residual by national governments, potentially with the support of concessional financing from bilateral or multilateral agencies such as the World Bank and the IMF. The grant funding gap identified by the access to COVID-19 tools, that is the ACT Accelerator, amounts to about $22 billion, which the G20 recognizes as an important gap to address. I mean, there is no firm commitment, but let's take it that the G20 backs contributing the 22 billion, or at least arranging for this contribution of 22 billion. That leaves us with a gap of about $13 billion in additional grant contributions, which are needed to finance the Agarwal-Tristan-Reed proposal or the IMF proposal. So clearly, we know from this that vaccine equity is not just for the global public health improvements, but also, and not just a human rights, it's not just the right thing to do, but it's also the best thing for the world economy. And the latest issue of The Economist, if you've seen it, it confirms that those with higher percentages of their population vaccinated are going to grow faster this year and the next, and in further years, because this has a cumulative effect. So sadly, the world's economies are going to follow two diverging economic paths, while the global economy, the world economy as a whole, is going to grow by a robust 5.7%. This is really going to come from one group of countries which are growing rapidly, because thanks to not only the rapid vaccination programs they have introduced, but also because of the huge stimulus packages that they've put in, which have helped them to recover, for their economies to recover much more rapidly. And there's another group of countries which is going to rapidly decline in economic growth. And millions in these countries, which are the poorer set of countries, are going to sink further into poverty. They're going to go below the poverty line, in addition to, of course, millions dying before this pandemic is controlled in their countries. So this is the sad situation, and these are the facts. Just a few days back, we had the G7 meeting in London, a group of richest countries, or rich countries, I should say, maybe not the richest. They hold, they contribute 40% of world GDP, and they came together in London, and this meeting came and went. And what did the group do? All they did was promise to deliver 1 billion vaccine doses between this year and the next, which, as you can see, is just a drop in the ocean in terms of what the needs are, the global needs and the needs in poorer countries. We are probably going to vaccinate just a small percentage, perhaps if the implementation in the countries that receive the doses is perfect, it's really, really good, delivery, logistics, and all that taken together, maybe the vulnerable populations and the frontline workers are covered by this, the doses that have been given so far and the doses that are going to be contributed, that are going to be delivered in this year and the next. Was this the best we could have done? Could we have done better? That's the question we need to ask ourselves. Now, everyone recognized, and quite early on, I should say, that there is an urgent need for enhanced multilateral coordination. International actions are necessary, and they did commence quite early in the pandemic. The United Nations Specialized Agency for Health, the World Health Organization, launched several initiatives quite early on in the pandemic after they declared that this was a pandemic, including backing a public-private initiative called kovacs with a specific mandate to procure and equitably distribute vaccines globally. There are also other initiatives taken by WHO, CEPI, and so on. And these are extremely important. The World Health Organization Director General, along with several influential opinion makers, have also supported two quite different external initiatives, not under the control of WHO. One is the waiver of intellectual property obligations proposed by South Africa and India in the World Trade Organization. And the other is negotiating a new international treaty for pandemic preparedness, which was first proposed by the European Council, endorsed by 24 heads of state, including UK, France, Germany, now endorsed by several influential opinion makers, and now on the agenda of the World Health Organization. Whether it takes place or not is not yet decided, but there is a good momentum, I would say, on both these initiatives, one in the World Health Organization, the Pandemic Treaty, and the other in the World Trade Organization, that is the TRIPS waiver, the intellectual property waiver. Yet, going by past history of negotiations in both these organizations, and let's take the WHO first, a similar and a less ambitious framework for pandemic influenza preparedness at the World Health Organization took a very long time to negotiate, and the outcomes, which require a majority support in the WHO, are resulted in a non-binding instrument, which really fudged a lot of issues, came up with text that everybody could accept, but in the end did not achieve very much, in my view. Now, we've seen the World Trade Organization. Negotiations haven't fared particularly well in recent years, mainly because, in my view, the constraint of the decision-making rule, which requires consensus for decisions to be adopted. We will see what happens with the TRIPS negotiations, with the waiver negotiations there, but it's not going to be easy to do. Besides waiving international intellectual property obligations at the World Trade Organization are going to do nothing to decrease vaccine inequity. This is because the manufacture of vaccines, these complex biologics, needs the active cooperation of the originator to reveal the tacit know-how involved, and so on. And this has been recognized by many who now say that the TRIPS waiver is not enough. We also need technology transfer. We need the cooperation of the right holder, because technology transfer will involve the cooperation of the right holder. Others argue that WTO's adoption of the Doha Declaration on the TRIPS Agreement and Public Health in 2001 to encourage compulsory licensing and so on was what led to the expanded coverage of the HIV/AIDS antiretrovirals, particularly in sub-Saharan Africa, which was suffering the most at the time of the adoption of the Doha Declaration. And this is what has led to the pandemic's slow but steady decline. And this is what is needed. It's the problem is intellectual property, and the solution lies in intellectual property. Also for the COVID pandemic. However, antiretrovirals, which were to treat the HIV/AIDS pandemic, they were small molecules. They could be reverse engineered quite easily, and indeed had already been reverse engineered or copied, if you want to use a simpler word, by Indian generic companies by 2001. Copies of these drugs, or the main drugs at that time, existed at much lower prices. And it became then very easy, once the Doha Declaration was adopted, to supply these medicines in large volumes through donor money, such as the US President's PEPFAR program, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, where the money came. There was money there, and there were medicines available to be distributed. They got distributed very quickly, and it is continuing, because there is the second line and third line and so on, which are continuing to be supplied, which led to the HIV/AIDS pandemic steadily declining, as I said. That's not the same situation today with the COVID vaccines. Maybe some therapeutics, but not all vaccines. Now, and maybe certain other products, because the waiver proposal covers diagnostics in addition to therapeutics and so on. So maybe, there are some that can be copied quite easily, but others, certainly when we're talking about vaccines, that is not going to be easy. Now, some have advocated that the US, the United States, and the European Union that made upfront payments to the vaccine originator companies, to some of the vaccine originators, should actively pressure these companies to share the know-how fully. I agree with that. They should. However, the opportunity to do so was at the time of making these payments, as a condition for making those payments. That time has come and gone, right? Others are calling for more money to be provided to buy out these technologies in order to scale up production in poorer countries. Now, that is a solution. Yes, I think it's a solution that could be tried. You could buy out these technologies. It's not going to happen that easily, because these companies are not that ready to sell. And the money to buy out, it's not very clear what you're going to do with buying out just the technologies. Will it come with all the know-how? Will it come with the tacit know-how also? Not very clear how that will work, because the problem is effective technology transfer of these quite complex vaccines would require both access to the relevant codified know-how. Some of it can be codified and passed on in documents, but there's a lot of uncodified know-how. For originator vaccine manufacturers to actively engage in multiple and simultaneous technology transfer activities in different regional hubs would not only involve sharing of the tacit know-how on a one-to-one basis, because that's the way it has to be done. You have to teach every manufacturer how to do this, right? But also closely monitoring the manufacturing process at every stage to ensure strict quality control. Now, originators have increased manufacturing capacity through almost, they claim, 300 partnership contracts, including with companies in the developing world, China, India, and South Africa in particular, also South Korea. And they claim that 10 billion doses production can be achieved by the end of this year. Some say that will only be 6 billion doses. We'll see how many come by the end of this year. But clearly, capacity is being ramped up as fast and as much as is possible, because there's money to be made, quite clearly. This is a window of opportunity, and therefore the companies will see, the originator companies that have the vaccines will see that they should actually ramp up to the extent that they can, keeping quality control in mind. Of course, they can do more, they must do more. If given the right incentives, they may well choose to manufacture in many more low and middle income countries and partner with credible companies in the coming months and improve vaccine supplies. And it's possible that we will have adequate supplies given the right incentives to vaccinate the whole world, if not by the spring of 2022, certainly by the summer of 2022. And that should be the aim of the international community, as the IMF has laid down very clearly in its paper on this. However, just a thought for you, all this talk about technology transfer and geographical distribution of vaccines in the middle of a pandemic where people are dying every day, thousands are dying every day, hundreds of thousands. We have to ask ourselves, really, is that our priority, regional distribution of vaccine manufacture? Is that the highest priority in terms of global public health and vaccine equity? Or is it supply of vaccines, no matter where it comes from, no matter where they are produced? Do you think a patient dying in India is going to kind of worry about where the medicine came from? Or somebody waiting to get a vaccine is going to say, no, I only want a vaccine made in a developing country or made in my country. No, they don't care. Give it to them at affordable prices or free of cost. It should be ideally free of cost to everyone. Wherever these are produced, how does it matter to the patient or to the person who's getting the jab or the therapeutic? I have an idea, if Sridhar allows me more time, I have an idea, a practical idea to deal with variants of this pandemic, the continuation of this very pandemic, and future global infectious disease pandemics. Because what I think, following on what the IMF has said, is immediately what the world needs to do, what the G7, the G20, the leaders of the multilateral system here, all, whether, whatever the multilateral system, the international community, let's say, the leaders of the international community, what do they need to do? They need to immediately set up a predictable, sustainable, efficient government financing mechanism, intergovernmental financing mechanism. It's not just a financing mechanism, it has to actually also be capable of implementing. So that's what the kind of initiative that needs to be done immediately. Yes, you have kovacs. I know kovacs is struggling. They're doing the best they can. WHO DG keeps pleading, begging, please contribute more to kovacs. That's not the way, this is not the way it's going to really, this is not the most efficient way for this pandemic, and certainly not for future infectious disease pandemics. We don't have to depend on charity. We don't have to, because we can take an initiative. The whole world, the international community can take an initiative that actually makes this much more efficient. So let's call this, as I call it, the International Pandemic Fund. Drawing lessons from the history and the governance of the International Monetary Fund. Remember, the IMF was set up to deal with the crisis post-Second World War, the Bretton Woods institutions. So we are in a crisis now, a global crisis. Let's set up this fund. This fund would have a charter that would mandate the development, the manufacture, and the equitable global distribution of essential products such as diagnostics, PPE kits, vaccines, therapeutics, whatever is needed for that particular pandemic for the duration of the pandemic. The IPF, as I call it, the International Pandemic Fund, should ideally be a temporary organization, because nobody wants to set up another bureaucracy, a permanent bureaucracy that you can't wind up and so on. We don't know when we will need it, maybe next. We know we need it now, but when will we need it next? We don't know. I mean, scientists keep predicting this is not the last infectious disease pandemic. There are more coming, and so on. So ideally, this should be a temporary organization. It could be set up at very short notice, unlike an international pandemic treaty, which will take years to negotiate, I can tell you. Even with the, this is not going to be easy. The waiver is going to take months to negotiate and will not result in any reduction in vaccine equity. Instead of all of this, why don't a group of countries take leadership? Doesn't matter. I am actually agnostic about who takes the lead here. Look, the G7 may not want to take the lead, so be it. Let some other group of countries take the lead. Somebody who's willing to put money in. So if there is a group of countries which can take the lead on this, let them agree to a charter first amongst themselves. The charter would have, as I said, the facilitation of the development, manufacture, equitable distribution. That's going to be like the constitution of this new organization. It should begin functioning very quickly at short notice, with a group of countries trying to kind of, make the circle larger, little bit by little bit. Let people contribute according to a set formula, according to what they can, whatever. Let them decide how it's done. As long as there's a pool of money that comes in, which is the beginning of this pandemic fund, let it be a plurilateral initiative where others join in when they see the need to do so, or they see the benefit to do so, whatever it is, it can start functioning immediately. And in future, sorry.
Yep. So let's, so 1 minute, shall we say?
Okay, Sridhar.
Okay.
Got it. And you can, I have details which, I can reserve for the Q&A.
Brilliant. There's lots of questions.
So the core, let me finish. The core of this organization, which will start functioning immediately, is going to have equity, global distribution, and equity is going to be at the core of this organization. That will be the core principle. And it will start in future as soon as the WHO declares a global infectious disease pandemic, and it will wind up when the WHO declares that the pandemic has ended. So with that, I stop. And if others have questions, I can develop my ideas further. Thanks, Sridhar.
Fantastic. Thank you very much, Ms. Fatal, for that. That was really informative and just sort of wide-ranging, and including your sort of presentation of an alternative to our current institutions and response. So what I would like to do now is that I would like to take 15-20 minutes in order to be able to ask you questions myself, and also have the members of the URGE panel, if any of them are online, for them to see if they would like to jump in and ask any questions. And then we will move on to addressing the questions that have been raised so far. So far, we have about 11 questions that have been asked. So let me start. So I think that I'm going to focus very much on the WTO waiver proposal, because it is seen to be by many to be the best and most quickest way to get more vaccines in the world and jabs into arms, as you say. Now, I think you've incredibly well highlighted one of the concerns that I have had, which is that the waiver is a waiver that says if we produce somehow the vaccines that people have patents to, we will not be punished in some way, legally or otherwise. Am I correct in the function of that waiver? Is that the purpose of that waiver? The idea is that there will be no legal consequences if we were to figure out how to produce these vaccines which have been patented. Is that the purpose of the waiver?
Yes.
Is that correct? Okay. So which is what I understood as well. So the idea is that if the waiver is granted, then either somehow the existing manufacturers will willingly hand over all the knowledge in order for third parties to essentially begin the same process of manufacturing. And so that would somehow, the assumption here is that these manufacturers would somehow be willing to share that if the waiver was granted or something like that. And this is an assumption that you say is not a good assumption. The second argument, if I heard you correctly, is that unlike therapeutics for HIV, these are particularly different kinds of commodities, namely vaccines. And you think that these have a much more complex structure that are not amenable to reverse engineering. And therefore, you think that stuff. So if I'm correct, that's the second sort of part of this argument, is that without the cooperation of the patent holders, you would have to reverse engineer somehow. And we're not clear that these could be easily reverse engineered. And therefore, we would be stymied at that level. So then the third part of this is the compulsory licensing is where the original patent holders essentially make agreements with third parties and they share the knowledge, etc., in partnership. But that apparently many people have showed, including you, I think, said it's too complicated and cumbersome and will not respond as quickly as we need it to respond. So what I hear you saying in terms of this current pandemic is that you have to let the manufacturers who hold the current patents and whoever will show up with new products essentially allow them as much possibility and freedom and support to increase the production. And then you want to buy from them as many as you need, as many as we need. And that is the best way that we can get more vaccines and jabs into arms. So if I understand it, those are the different lines of arguments that you have made. And so I just wanted to see if I was correct and if you wanted to add or subtract to what I've just said.
Yeah, Sridhar, by and large, what you're saying is, is correct. Just one thing. If IP owners willingly, you're saying the assumption is that IP owners will willingly hand over technology. I don't think anyone is saying that the waiver is going to lead to IP owners willingly handing over technology. They are saying IP waiver is needed in addition. Originators should willingly hand over technology, tacit know-how, and all of that. So my argument to that is that, if IP owners were willing to hand over technology, tacit know-how, etc., you wouldn't actually need a waiver. So you're asking for both, but actually the latter, which is the more important one, will actually negate the need for a waiver, right? Because it's willing, it's voluntary. And the second misunderstanding is that the compulsory license means sharing knowledge voluntarily. No, a compulsory license is without the willingness of the right owner. So in that case, you should really, the third party, which has got the license from the national authorities, whether it's the patent authorities or the courts or whatever, those third parties must already have the know-how and must already be able to make it. Now, I'm not saying this won't happen eventually. Maybe, and the WHO is doing its best. They are trying to get people who know about mRNA technologies. There are collaborations which are happening between certain American universities, companies, and producers of vaccines and LMICs in particular. I know two examples, Thailand and India, where mRNA vaccine collaboration is going on, and they're already in the early stages of such collaboration. But it will take time. And what you're doing with this? You're reinventing the wheel when you don't have any time to do so. You're in the midst of a pandemic. You can't be really reinventing the wheel and taking all this time. That's terrible. I mean, it may be an eventual solution. And in any case, getting mRNA technology into the developing world is a very good thing. And all this should be encouraged, irrespective of whether it can deal with this pandemic or not. I think that's a fantastic thing, because the mRNA vaccine, the mRNA platform in general is going to be helpful for so many diseases, and it's a good thing to do. So in the long run, that's a good thing. But will it really solve this problem, this particular pandemic? I don't think so.
Yeah. Okay. So I think those are really helpful clarifications in order to understand the actual patent waiver and the voluntariness and the forcedness of the different dimensions of it. If I could just translate this a little bit into ethics language, what I hear you saying is that the question here is about the timing is really important. The question is, given this terrible situation of mixed motives of different actors, the question is, if our aim is to save as many lives as possible, what is the most efficient way of doing that? And so you think that by your calculations, the fastest way to save as many people as possible is essentially pay the patent holders what they want in order to manufacture as many possible as we can. That's the immediate term. And I don't know whether that's a 6 months or 1 year, but at the same time, encourage other people to develop products that are cheap and cheaper as possible, and that are also effective. And that is also on the running. And you're also sort of promoting this sort of around in the back kind of relationships between knowledge holders in rich countries or wherever they might be, and sharing of knowledge, so that outside of these pharma companies, there's also the possibility of other products that come through that have more what we might call sort of egalitarian or cosmopolitan intentions, where they're from the beginning aiming to get cheaper, faster to as many people as possible. So that's also really interesting. What I'm going to do now is I could talk to you all day about this, but I think that would be unfair. So I'm going to ask if there are any panel members who are present that want to ask any questions, just to give them a priority. And I think you can raise your hand. I don't know if we can, if I can see it or not, but somehow so I can see all the participants. So I think that if you raise your hand, we'll be able to identify you. So while if any of the panel members are online and want to ask in person, or you can write your questions in the question and answer box. So meanwhile, I'm going to go through some questions. We now have about 25 open questions, and I'm going to just try to take a look at them. I want to encourage everyone. We are up to about 85 people who are attending. I really encourage you to write your questions in the box. Not only will it be helpful for us in this session, but it's also really important for us, all of us who are working on this issue, to understand what are the knowns and unknowns that people are looking for and the contours of this topic. So I'm going to make one remark. I don't think I've seen so many anonymous attendees at an event like this, which tells you something, I think, about this issue and who is here and who's not and why they're anonymous. But despite my reticence to ask answer questions from people who are anonymous, I'm going to actually weigh the questions based on what I think is worthwhile. So let me start with some minor objections to your presentation, which you should take I think you were expected it. So I will let you handle them. The first one is someone's taken offense at your description of the pandemic influenza treaty as being ineffectual. So they say, in contradiction, it has really supported countries in building surveillance capacity, and pharma industry has contributed about $200 million as benefit sharing to date. WHO's analysis shows it's very successful. Do you have a response?
It depends. It depends on your, your measure of success. You can always set the bar so low and say it's been successful. And by that standard, yes, it's a success. I leave it at that.
Okay. So the second thing is, a lot of people have heard what you've said as if you are saying that developing countries are unable to manufacture these vaccines. And I think you made a different point, not that they're unable, but that the patent holders have to provide them the information. And without providing them the information, the reverse engineering bit is not going to be as easy as people think it is. So for example, let me read the question. Many developing country manufacturers are already supplying vaccines under WHO pre-qualified system. So the idea that need to teach every manufacturer does not take this into account. At least half of the global vaccine market is supplied by developing country manufacturers. So what do you say to people who are hearing what you say as if you are saying that developing countries cannot manufacture these vaccines.
Hey, I come from India, okay? It's a country that contributes the most to vaccine manufacture. So I'm completely aware of the capabilities of developing countries. And you have also, Senegal, the Pasteur Institute in Dakar, Senegal, and so on. So that's not the point I'm making. I'm making another point. Yes, they can, and yes, ideally, technology should be shared immediately, unconditionally. Right now, that's not the case. So how do we get jabs to arms as quickly as possible in the poorer countries? Do we need to really go through all this, reinventing of the wheel, setting up all the regional hubs? Is that our priority? Or is it getting vaccines where we need them, therapeutics where we need them as quickly as possible? We are in the midst of this crisis.
Okay. So the second, also quite pointed question is about kovacs. So we can talk about your proposal in a bit, but I'd like to get the is before we get to the ought bit of this. So, you said equity would be at the center of your proposal, but the argument is that equity was the center of the kovacs proposal. So from what I understand, the idea was that rich countries would contribute money into this fund upfront, and they would be able to purchase up to, if I understood correctly, 30 or 35%, I don't remember the exact number, of their population size. They could buy that much amount. And then poor countries could buy up to 20%, if I understood correctly. And so this was considered to be equitable because rich countries would be putting up the funding up front, which would allow the development and that to happen. And then the poor countries would, at some later point, be able to finance as well, but they would, once the technology comes, we would come and get it. So that's the one question about equity. What is it that you think was wrong with that understanding of equity? And the related question is, South Africa and India saw this, and they said that some reason they thought that this was not a good enough solution, and they went for the waiver. Could you help explain those two things?
Yes. So, as I said, COVAX is an initiative that was thought on quite early in this pandemic, quite early. However, it was a voluntary initiative, backed, of course, eventually by the WHO, but it doesn't involve governments. And it depends on donations, whether it is donations of money or donations of doses, right? And then with that money, they are aiming to buy up. Now, why is it that COVAX has done so poorly? I mean, by their own standards and by their own limited ambitions, despite their best efforts, they have delivered only 88 million doses or less than 4% of total deliveries made around the world. Okay, when I say deliveries, this is not delivery jabs to arms, but deliveries in the countries, okay, by the UNICEF dashboard. Now, frankly, that's a failure. It is a failure. And frankly, in the face of such a huge global infectious disease pandemic, should we be dependent on Bill and Melinda Gates Foundation? Should we be dependent on voluntary efforts? Should we not, as an international community, as governments in the international community, take some responsibility for what should be the solution? It's not just throwing some doses and some charity. We have to think of this systematically, not just for this pandemic, for future ones. And why am I saying infectious disease? Yes, there are lots of global health problems, but the infectious disease pandemics are the ones which spread from one to the other and where the whole world has a stake in it. If we can't come together for that, for infectious disease pandemics, when are we going to get our act together?
So I appreciate that, and I appreciate that sentiment, but If we go back a year ago, I can guarantee you that most governments would not have appreciated the scale, would not have appreciated the danger. It's a retrospective analysis, right? So you're saying that this is what we should do. But in last spring, basically, it was recognized that this is what leadership apparently is, right? This is what leadership is, where certain individuals take it upon themselves to sort of recognize a problem and they try their best to find a solution. And so the heads of the two richest health foundations and the heads of some basic organizations came together and they believe that they have expertise and generosity and the ability to muster a solution. You're saying, well, no, that's great, that's wonderful, but it's actually governments that should be leading this response, but they haven't. And it's not clear that they will. So I don't understand why you think that they will tomorrow rather than they didn't last May.
You're absolutely right that, frankly, everyone's thinking for themselves. And it's not like they didn't recognize the danger. Everyone knew this was going to spread. This was highly infectious. They knew that quite early on. Everyone looked after themselves. I mean, US for itself, once the US did that, EU for itself, that's exactly what is wrong with this. We are having this chaotic situation today because the big countries or the big jurisdictions just looked after themselves, which I am saying is the wrong thing. So instead of just, having lip sympathy for vaccine equity and throwing some charity here and there, let's look at it holistically. Let's look at it as how is the world going to deal with this situation multilaterally as an international community, and it's a drop in the ocean, the $50 billion that the IMF has estimated. And, there are people quibbling about the numbers there. Frankly, double it, and even then it's a drop in the ocean compared to the global benefits for the world economy, which is $9 trillion. So this is why I'm saying it has to be the governments that look into it. And, there are supply chain issues which have come up already. Those issues really need multilateral coordination, and it's not any one organization. It's not like the WTO by itself can say, hey, I'm going to look at supply chain issues and I'm going to solve the problem there. No, this has to be done by another organization, which is just looking at the pandemic and nothing else. That's the priority here. And we need an organization that makes it its whole and sole objective.
Okay. So yeah, there are lots of questions about your International Pandemic Fund, and I want to get to some other questions before we talk about what would be similarities and differences for that. So the first one sounds like a question from a fellow lawyer about TRIPS. So I'm going to read it carefully. It says, thank you for an excellent presentation. You mentioned that a TRIPS waiver would require consensus among WTO members. By consensus, you mean 100% or sort of no objections, but consensus. However, Article 9 of the WTO agreement, paragraph 1.3, seems to say that a ministerial conference would require such a decision to be taken by 3/4 of the members. There is then an ambiguous looking footnote to Article 9 that refers to a transition period or a period of staged implementation after which a decision to grant a waiver shall be taken only by consensus. So my question is, can a TRIPS waiver actually be decided by a 3/4 majority, even though a consensus is preferable, or is the 3/4 majority mechanism no longer available? And I think the importance of this is that essentially over 100 and some countries are pro-waiver, and the minority is actually against the waiver. So this 3/4 would allow the passage of the waiver proposal. So what's your answer to that question?
Right now, the discussions are going on in the TRIPS Council. The text-based negotiations are going on in the TRIPS Council, right? That's a body of the WTO. that looks at intellectual property. Okay, for those of you who are not, familiar with the WTO, it's the TRIPS Council is the body that does intellectual property. Text-based negotiations have begun or will begin. I'm not sure because I'm not following this closely. I'm not an insider anymore in the WTO, but it's imminent. Okay, and serious negotiations will begin on this. The decision in the TRIPS Council will be taken by consensus and forwarded to the General Council, which operates in between ministerial conferences. So, it's possible that it goes up to the forthcoming ministerial conference, the MC12 in end of November. It's possible it will be done before that. Who knows? So it does require consensus. Now, there is another option, which is part of the WTO legal framework, which allows for voting. So some have said, and I've seen this argument, that frankly, the waiver is through because, if it goes to vote, we have the numbers here. I mean, we meaning the developing world has the numbers, the proponents and their supporters have the numbers, and this can go to vote. But it's very unlikely that it goes to vote. It's never been done before. It's possible this will be the only exception to that rule, or anything is possible. But for the moment, doesn't seem to be the case. My point is not about the legalese of all of this. My point is, even if there is a waiver, what is it going to do for you? Today, least developed countries already have an exception. They already have a waiver, so-called waiver, for the pharmaceutical obligations in the TRIPS agreement. Obligations relevant to medicines, that includes vaccines. Already there is a waiver for least developed countries. People talk about Bangladesh having the capacity. Bangladesh can go ahead and do whatever they like. They can do whatever they want, which they are, which they will do if there was a waiver. You know what I mean? They already have the waiver. So if it hasn't worked, what is going to work in future when there is a waiver?
Okay, so that's interesting that you're saying that essentially there is already, in a sense, some countries have the capacity to go ahead and do what they want regarding medicines, particularly in an emergency. And so what was India and South Africa thinking? What was, you must know what India must be thinking. What was it doing when it sort of put together this proposal?
I have no idea.
Okay.
I'm not part of the government of India, and I'm sorry, I have no inside information what they were thinking.
Okay, so let's now move on to your proposed solution. So there's a number of questions. So the first question is, you are suggesting a new institution that would essentially move outside of kovacs and that would move outside of Global Fund, et cetera, which would be specifically designed to address the urgency of pandemic threats. Now, you are not saying, if I understand correctly, for this particular pandemic, for the next pandemic, right? So if that is the case, there are a number of questions that are saying, how, if the current situation where rich countries are not putting in the money that they should, lots of countries pledge and then they walk away, what is it that your fund, how is it that yours fund is different than the one that relies on the goodwill participation of all the countries, particularly the ones that are likely to pay more into that fund?
Okay, so I believe that civil society has a big role to play in solving the problem of this pandemic, right? Civil society has put in a lot of effort into getting public opinion on the side of starting text-based negotiations in the WTO. Full credit goes to them. I think it is wonderful that civil society can kind of, through moral suasion, make such a big difference, okay? Civil society different parts, I'm describing it very generally, also managed to get very, very high-level opinion makers behind the International Pandemic Treaty, negotiations in the World Health Organization. Why then is it so difficult to believe that civil society, as a general term, cannot shame the richer countries into putting money where their mouth is, so to speak, instead of just saying, we believe in vaccine equity, we think this is a bad situation? Why is it that pressure cannot be put to contribute something which is considered a drop in the ocean compared to world GDP, to actually deal with the situation today, right now, urgently?
Yeah. Okay. So your solution then places a great burden and responsibility on advocacy of essentially citizens and civil society organizations to get their governments to participate in the fund and then contribute to the fund. I think, and then so basically certain kinds of leaders who see it as being responsible, et cetera. Now, a number of questions are asking the second thing, which is not about where will the money come from, but what are the protections in your fund against the political machinations that have been going on currently in kovacs, currently in lots of other things? What would protect what would make your idea immune from that problem?
Very good question. Excellent question. That's exactly why I think the International Pandemic Fund should be an independent entity, should not be affiliated to the WHO, although it should closely work with the WHO, should not, it should work with kovacs. Frankly, if you're going to do this in a very short time, you cannot but depend on the expertise that kovacs already has. So you have to kind of cooperate and subsume, in a certain sense, the work that kovacs is doing, but it has to be led, it has to be guided by governments. Okay. Now, I am thinking of a structure which is not based on consensus. It's going to be more like the executive board of the IMF. I know people hate that. They hate the IMF executive board decision making, but it's effective, it's speedy, and in a crisis, that's what you need. So the more those who put in the money, by the amount of money, they will have a share and they'll have a seat at the board, right? So the biggest contributors get a seat at the board. You can group up, there'll be smaller contributors. Even developing countries should contribute. Everyone who wants to enter shall make some contribution in proportion, an equitable contribution. And they can group up together, they have a seat at the board too. So it's governments who are going to lead this, governments who are going to decide this. Decision making is going to be quick because there'll be a limited number of participants around the board. It won't be 164 countries trying to arrive at consensus.
Okay. So the head of the IMF is always an American. What does that mean for your fund?
Hey, if it's China who puts in the most money.
No. So which leads me to, your initial argument, and some of there's a couple of questions about this, is that your perspective that, global growth and global loss to the economy is in the trillions, and this would be in the 50 billions. But at the same time, you also put a story that says there's a divergence happening where the richest countries who got the vaccines first and have given it to their countries are going to be growing and getting good growth. So the two perspectives are in opposition to each other. One is I think about the entire world and the benefit of the entire world. And the second one is I think about my country and what benefits my country. So I'm not seeing a solution here about these two contradictory approaches. You have made an argument that that people are not recognizing that an infectious disease pandemic is reflecting our interdependency. right? And so one solution is that for your pandemic fund to work, people have to understand this interdependency and see that there's no way out of it, that you can't simply do it. So that's a third assumption of your solution, which is that people have to recognize the interdependency and that there's actually no way that your country will be able to grow sustainably if the rest of the world is not also growing. Yeah, but that's an empirical question, right? We have to see.
Yeah, we are already seeing. Don't you see the Delta variant, first seen in February in India? It has now spread to so many countries and is now, the majority of cases, new cases, are coming from this variant. Okay, and it's, according to some thing I've read, is going to be the predominant variant, the highly transmissible, much more deadly than the previous variant, and that's going to continue. So, people are short-sighted if they don't see this. And yes, the world is short-sighted, and yes, taxpayers in different countries are short-sighted because they don't want their tax money going into something which is going to benefit some other country. But this is actually the basis for all international cooperation. Don't countries put money into the IMF? Don't countries put money into the WTO or the UN or whatever, the international system? It's not something new.
Yeah, so I think that so this is also interesting in two different ways. One is empirically, the interdependence is interesting because a lot of macroeconomists have been examining and understanding what the relationships are of different economic policies domestically and internationally and the interdependence of it. We have not done that so well in health. And I also think in TRIPS, I don't know if I'm correct, is that a lot of people who were working on the TRIPS agreement saw medicines as individual consumption goods that are valued by the individual rather than goods that protect populations and the global community, right? So that, in essence, goes towards the whole public goods argument, but they really didn't appreciate perhaps the interdependence of that kind of. So I think we'll see a lot of ideas about global security and interdependence and how health is moving into that. So for us who work on global health ethics, a lot of the work around global health justice has been a charity model, which is what should we rich people do to help those people over there? What are their rights? What are our obligations? Very few people have actually thought of this interdependence and the idea that our health, my health is interdependent with the other health as well. So your fund essentially has to work on that, right? People have to have a recognition of that interdependence.
Exactly, absolutely.
Yeah, and if it's not there, what would you do to show it?
Frankly, I think people do recognize it, especially with infectious pandemics. They do recognize it. It's a question of being reluctant to put money, down. The needed money. They've put some money. Definitely, kovacs has got some money. It's pretty good, but it's not enough. So that's the reason why I'm saying we need big money here. We need to think big here, and it's for the whole world. We need this, and if we can't cooperate in this situation, where the crisis is staring us in the face, we're in the midst of the crisis, and we're still not able to get our act together as an international community. When are we going to do it? The world came together after World War II. They came together and they set up a lot of good institutions because of certain leadership. Now, if that leadership is not forthcoming from the same countries that did set up the Bretton Woods institutions and so on to get some global order going, or the United Nations, League of Nations, let's go back in time. Everything came after a crisis. If we can't actually get our act together now, when are we going to do it?
Yeah. So in terms of radical propositions to a new world past this crisis, there has been a lot of questions that have been addressed regarding the business model of pharmaceutical companies. So right now, even one of your answers to our current predicament is essentially, look, pharmaceutical companies essentially have us by the neck. And so in this emergency, we essentially need to get them to keep running their machines so that they produce things, and we pay them whatever it is that we're supposed to pay them because we need what they produce. Do you think that there is a opportunity here or a necessity here for essentially health commodities, not just vaccines, right? So we're talking about lots of other things, to be treated as a different kind of commodity with a different kind of business model?
I do. I think there's a great opportunity, because what I'm thinking of in future is, it doesn't have to be this way. If you're giving money through the fund, a multilateral fund, which is going to give money to promising candidates, as was done this time, to encourage them to come up as quickly as possible with the needed products, then put some conditions on them. Tell them how this has to be done, how it's going to actually make big pharma come together. Because once you have a monopsony, that's what's important. It's important that the fund acts as a monopsony, a single buyer, or the largest buyer, the largest single buyer in the world. Then you can dictate conditions. Where are you going to dictate conditions when you don't have that kind of power?
Yeah. So we're coming a bit closer to the end. We have a few minutes, and I'm now going to ask you some pointed questions. So tell us, for people who don't know the WTO, so you have the head of the WTO, and what is her predicament? Is she in a predicament, or is she, what do you think her different pushes and pulls might be, so that we can understand what she's saying and when she is saying? Because it's not clear, right? So apparently she has to be objective and she has to be neutral. But tell us more about who the strongest actor is in the WTO, and what their and that may not be the head of the WTO, and what the different dynamics are, so we can understand what's happening.
It's a complicated question.
Yep.
It's a complicated question because the WTO is, in the past, it was a certain animal. And who knows, with the reform and whatever, in this particular situation, whether it can change. Now, you have the head of the WTO who's very committed to vaccine equity. From all the statements that she has made, it's clear she's committed to vaccine equity. She comes from a certain background because she was the chairperson of the Gavi board. She's aware of, she's fully acquainted with vaccines and the problems, and she's obviously in day-to-day touch, or at least close touch, to understand what these issues are. But her role, or historically the role of the Director General of the WTO, has been to be an honest broker. So to bang heads together, to bring people with differing perceptions together, and to make sure that a solution emerges which all the members can buy into. Not that they agree with 100% of it, but they can buy into it and they can live with it. That's the consensus, that they can live with it. They will not object to it at the end of the day. So that is her role. And now that there are text-based negotiations, her role is to make sure, if needed to intervene, that is, it's the TRIPS Council chair first who will facilitate these negotiations with the help of the Secretariat in the division that deals with intellectual property, to come up with a consensus on this issue. And where needed, she will step in at a higher level to ensure that everyone is listening to each other, and there is a scope for coming together, and how this text will look at, which everybody can agree to. That is the rule.
Excellent. And the second, I guess, sensitive question is about China. So a lot of the debates have been focused on the people that are against the waiver, which is like the EU and the UK, etc. But really in the background, what we see is China rapidly manufacturing its vaccine, I think one or more, and distributing those vaccines to many low-income countries. Do you have any insights into that? And what so basically, it's sort of sidestepping the WTO entirely and essentially, providing vaccines to LMICs. You didn't kind of identify that as a solution, right? So basically, a country like China essentially producing more and more, and then sort of giving. So what are your thoughts on China, its vaccine rollout, and its potential role in solving this particular problem?
So China, like other countries, there are other countries, has the capacity to make its own vaccines, its own original vaccines, right? Cuba does too. Huh? India has also come up with its own vaccines. So China's commitment to giving to some countries is again a drop in the ocean. It's a good thing they're doing. I mean, there is this vaccine diplomacy where a lot of countries try to benefit through vaccine diplomacy. India did the same in the initial days when it thought it didn't have the problem in its own jurisdiction. So that's not a solution. You can't depend on countries who are thinking of the benefits they can get through vaccine diplomacy. That's exactly why, charity and vaccine diplomacy are just drops in the ocean. They're never going to be the solution.
Okay. And so finally, I guess I wanted to see if there's any but there's been a lot of questions about, how is your fund different from kovacs? How is your fund different from these other kinds of stuff? And will it function any differently? Will it be immune to sort of politics? And I've tried to raise those points with you. I'm assuming that this is a proposal that you are developing and you're going to put out into the world. And do you already know where that is going to be, or how you're going to, or you're still in the drafting development stage?
I'm still in the process of really thinking it through, and I really appreciate the questions that have been raised because some of them are valid questions. I would like to see the record of the Q&A. If Sridhar, you could share this with me, because this will help me think through. I'm also kind of, I'm not the competent person for all of the various aspects that I'm looking at. And I'm certainly looking for expertise to help me on these aspects. None of this is, written in stone. I'm open to all suggestions, but, this is as far as I have come in my thinking, and I have some details too. We don't have time to go into those, but I'm happy to engage with anybody who wants to engage with me bilaterally. I'm sure my email is known to many people. Otherwise, please do put it out on the website for this this event, so that anybody who wants to engage with me bilaterally is welcome. I mean, I'm happy to have a conversation with anyone who thinks, even if they think it's complete nonsense, please, we are here brainstorming, and that's what I'm doing. Just, is there a better way? That's the question.
Yeah, and I think that that's a completely valid approach. There has been a lot of different proposals. So members of our own panel, for example, have suggested that they can come up with a better model than kovacs that they've sort of tried to work on. There's been other particular philosophers who've tried to focus on funds that pay on impact rather than on the costs of different kinds of patents, etc. So I think that the interesting thing about your proposal is that it's informed by your experience inside the WTO and how it works and what the actual legalities are. But also, I think that this discussion raises a number of bigger questions and issues. Number one, the question about governments should be the first responders, and they're not. And so how do you get governments to be the first responders, and how do you do that? That's a problem, that is not about money, it's something else. I would say that it's about political philosophy and ethics, but that's one. Two is that even in your solution, civil society has a significant role to play. And our current solution, civil society has made it at the table after a long time of struggling, but you are sort of acknowledging that that's from the beginning, it's going to be an important determinant. So this does mean that civil society responding to health crises and pandemics around the world are going to be an important players in whatever the way they do. Third, I think that you're raising this question about governance within any institution needs to be more transparent in the way that it does. Fourth, I think that you've also raised the big problem is that there is an inherent inequality between rich and poor countries, and you're not. And your solution is much more pragmatic, which is that we're not going to be able to radically solve that inequality through a waiver, but we have to figure out those are long-term through transfer of knowledge. So all this vaccines, medicines, they should all be easily producible in all countries. And so that has to be a background project of any kind of stuff. So I think those are all really profoundly important lessons that we can take away from it. So I want to give you just a couple of minutes if you want to say anything in conclusion.
No, Sridhar, you've summed it up very, very elegantly and brilliantly. So thank you so much for that. And you've been a great moderator. So I also want to thank you for that. But again, I mean, I'm just, this is just one idea. I mean, I'm open. I think there should be a brainstorming of different ideas, which are pragmatic, which are practical, which are immediate and urgent, for this pandemic, and workable solutions for the next pandemic. So with that, I encourage everyone who's listening in to and who's interested in engaging with me to please reach out and get in touch. Thank you.
So fantastic. So with that, let me first end this session by thanking you, Jayashree, and I really appreciate you, taking the time for this. And it's really been informative beyond the rhetoric to be able to understand the intricacies of things and to also hear your arguments about a better proposal. And so I want to really sort of say thank you for your time and generosity. Second, I want to once again thank the Global Health Center at the Geneva Graduate Institute and all the people that have made this logistically possible. And third, I want to thank all of you for showing up for this session. I know that many of you are probably experts in this area. And so I want to thank you for joining us. And also, I want to thank all of you for asking questions. As I said, the questions are as important as the presentation because it allows us to understand what the different questions that people are asking and the contours of the subject. So before I end, there's two sort of announcements to make. One is that the Global Health Center the next event is on June 25th, and it's called Support, Not Punish. And it's about the legalization of different kinds of narcotics. I apologize if I got that wrong, but it's a conversation with Carl Hart. And then also when you leave today, when you jump off the session, you're going to get a box that asks for your feedback. It would be really, really helpful to me and to the center if you could provide some feedback about how you thought today's session went. It allows us to make these sessions better and more relevant. So with that, ladies and gentlemen and friends and colleagues from around the world, thank you very much for joining us today. And we hope to see you again another time. Thank you and goodbye.